And so I'll start off by introducing our presenters today on HR and personnel issues. Andrea Yan is legal counsel for the school, for the university.
For the university, but focused on health sciences.
Okay. Has a great understanding, I think, of the School of Medicine from, her legal perspective, and has eyes on a lot of our regulatory infrastructure and unfortunately sometimes what can go wrong to help us all avoid that. And it's great for her to be here and share that really experienced perspective. I mean, she advises the university's leadership, the dean, other leaders on, all kinds of aspects. So she's really brings a lot of experience and expertise and perspective to the table. And then we also have Michelle Wafer, who has her own perspective and expertise in the field of personnel management. So she's in HR. I'm sorry, I don't know what your title or your role is.
That's all right. HR is great. No, HR Senior Generalist is the official title.
Okay, and you are in support of the School of Medicine for HR issues.
Yes.
So that's really great for us too, because you're the one that we're connected to as we're hiring or firing or managing or doing our performance evaluations.
And supporting staff as well.
Pardon me?
And they intersect directly with staff as well
Intersect, yeah.
to support
Okay.
someone who needs something, benefits, etc.
Yeah,
So that's nice.
great. And faculty,
And
if we have benefits, questions, etc. Okay, well, thank you for being here. And I guess I'll start by asking the two of you if you would like people to hold their questions till you're done, or we'll just chime in.
I think questions along the way, if you're good with that.
Yeah,
I mean, I
yeah.
feel like it's a small enough group. We can have dialogue, and knowing that there's time at the end too, that if you want to wait or as you think about things and ask questions at the end, that works as well.
Okay, and so that goes for Dr. North, who's joining us on the phone, or others of our administrative oversight leadership infrastructure that are on the Zoom as well. If you have a question or a comment, please. I think we're small enough that you could just unmute or maybe raise your hand as you unmute and ask as well. All right, thank you both, and I will let you take it away.
Hey, it's all yours.
Okay, well, can everybody see me? I mean, or would you prefer me to, I can stand up, sit down. So, today we put together a deck presentation, really factoring in feedback that we've received from Dr. Hansen, Brianna, Dr. Bartz, in terms of maybe some key topics to cover. So that's really what set the foundation for this. A lot of the information that we're going to go over, at least I can speak to some of the sections that I'll cover, this information is available in other manager resources. And so, rather than say, go watch this video or go read this training, since we're together today, really want to maximize the time and cover some of those highlights. So really the goal today too is to be able to equip you with some of these resources. So down the road, 6 months from now, something comes up and you think, oh, I've got a question. You've got that at your fingertips as well. So we have a number of things to cover, and Andrea and I are going to kind of do teamwork on this. I'll cover some areas, Andrea will cover some others, and I know as I go through things, Andrea chime in as well, with some perspective. So what we're covering today is, first of all, just an overview of manager resources that are available, payroll and wage and hour classifications, best practices in communicating, navigating complex situations, documentation and data security, interviewing, and hiring students. So a lot of different things. So hopefully we'll get through all of it and take it from here. The first thing I wanted to cover is manager resources, because I think there are things out there, but sometimes it's hard to find them. Or maybe that's just me. So there is a manager toolbox out there. I've taken some screen, oh,
Second, are we gonna share the slide deck afterwards so that they can click on the
that's my
hyperlink?
intent, yeah.
There you
That
go.
we can save it and send it to you. Yeah, yes. So that way, again, so you have this moving forward. Originally, we can maybe go through some things later too, if we want to like navigate through different sites. I know sometimes that can be a bit clunky while on Zoom and switching the screens that you're sharing. So I've just taken a couple screenshots. But the manager toolbox is listed by, has different categories, and it's really sort of intended to be a one-stop shop that you can go to look for, you know, if you're looking to hire an employee, you know, what are some steps to go through? It's not on, if you find out an employee's leaving, they've submitted their resignation, you can go to Leaving Creighton. There's a new offboarding checklist that you can go through, and it has employee responsibilities, manager responsibilities to prepare for somebody's departure. So there's a lot of resources out here that are available to you. And so I'm going to pause. Until this moment, how many of you knew the manager toolbox existed? Okay, well, too, that's great. So, and that's the piece too, where, thank you, that, you know, as I've had conversations, you know, then I find out that people are like, well, no, I didn't know this was out there. And so really, I think we can continue to do a better job of publicizing it, but just want to make sure you know that it's out there.
So Michelle,
Yes,
so as I've been at Creighton since 2000.
Yeah.
The rules are always changing and I can't keep up with them. So like rules around how comp time works or is permissible or not
Mhm.
have really changed. Policies on volunteers. Do all of those things get like sort of time in a timely way put into that website?
that's a great question. And the answer is no, because right now, different things are housed in different places. So for example, yes, when you since you mentioned like comp time, overtime, there are overtime guidelines that are housed in here under compensation. But some policies, you know, there's a whole separate policy library that's owned by general counsel. And so there's a lot of policies that live on that side. There's various guidelines that, you know, are here. So it is complicated. And I think, Andrea, you can speak more to this. I mean, I think, is there something like a broader, is it kind of a
There-
long-term project to look at how do we do this or?
And
or no?
actually, there's a couple things that that I'll say in response. One, some important things are communicated through Creighton Today. If you're like me and you're not a great reader of Creighton Today, you can miss some of those announcements, but that's one way in which we try to communicate things. I know HR is trying to improve its website and keep these types of resources current. When it comes to university policies, I mean, it takes 5 minutes of being here at Creighton to realize that they exist in all these little rabbit holes, right? The university invested in a platform that we're calling Navix. I think that's the vendor's name. And it is still in the build. I believe they are running a pilot with nursing and dentistry to put their school policies, like faculty bylaws, as well as school policies applicable to students on there, with the goal of building everything into that one place. So you would have one place where, as a school of medicine person, you would see student policies, faculty policies like bylaws, university policies, HR's finance, and so things would only reside in that one physical electronic place. And if your school has a resource page, you'll be linking to that. So then we will have fewer of the, am I looking at the right version issues? Because I mean, even IT today has a policy posted that's not, and we have a policy posted and whose is actually current. You know, you have to look at dates because somebody's not linking and correcting what's up there.
Okay.
So we are in a build process. We've had the resource for over a year and we just began the build with those 2 pilot schools in the last month or so. So,
Okay.
yeah.
Okay.
And every policy that exists today has to be converted to that formatting on some level because headers are changing, et cetera. So it's gonna be,
Okay,
yeah,
sounds awesome.
there you go.
Not holding my breath, but it'll come.
It's coming, just. Is it the
It's a
second
marathon.
coming?
It's a marathon.
Thank you.
Great. Any other questions about the manager toolbox? So There's also ongoing learning events. So Julie Olson is our learning and development team of one within HR. And she's put together a calendar of upcoming learning events. And the link to that is on the first slide. This again is just a screenshot because out there's events that are for all employees, like this shown on the screenshot, or how to set SMART goals and how to enter goals in My HR. There's also what we call a monthly manager briefing series. And so every month there's a different topic that is applicable to most managers. And so for example, I think the one coming up in September is on compensation. There'll be, in the past, there was one on managing payroll or payroll for managers. Some of the trainings are facilitated by the subject matter expert within HR, but we also, or Julie will partner with others. So for example, a couple of the trainings were facilitated by Magellan, our EAP provider, as well as like EDI, members from the Equity, Diversity, Inclusion team facilitated a session in May. So working with different partners throughout. All of these sessions, you can register for them. They are all via Zoom and they are all recorded. So if you're not able to attend, you can always access it. And that's the lower screenshot. If you can see that, is that when you go out to upcoming learning events, you can see what's out there on deck for fall of 2023. But then if you go towards the bottom of the page, you can see where you can access to view recordings from the previous sessions. And so I find that very helpful. Refer to quite a few of those in today's deck, because you can view the recordings, and for most of them, the slides are attached. And so sometimes if I go back, I like to just look at the slides to kind of see some of the key details. So just want to make sure that you are aware of these resources moving forward as well. Any questions about that before we talk about payroll and wage and hour? Okay. So, this, as I mentioned, I think it was in November of 2022, members of our payroll team did lead a payroll for managers session. So that whole session, that 45-minute session is recorded. So again, these are kind of the cliff notes from that. But we have two different classifications for salaried employees and hourly. So salaried employees, they're considered exempt. They're paid monthly on the last business day of the month. So examples of that would be, like your postdoc research fellows. I think all of us in here are salaried or exempt. Employers are not required to pay overtime to employees who are properly classified as exempt. Then we have hourly employees. They're paid every 2 weeks. They are entitled to overtime pay when they work more than 40 hours in a work week. And here, our work week is Saturday to Friday. I've included a link to the payroll schedule. For those of you who are currently approving time cards, you're probably pretty familiar with this. And the payroll schedule includes pay dates for hourly as well as salaried or monthly. Generally speaking, salaried employees, they show up, we do our job, and really the only time we're interacting with My HR to report time is time off. If we're taking some sick time, some vacation time, bereavement, whatever that may be. The majority of the next couple slides that we're going to cover, really, we're going to talk more about the hourly employees, because that's where there's some more legal requirements.
The exempt versus non-exempt, it's driven by federal standards. And I just come across the newswire this week that the feds have proposed another change in that dollar amount. Whether that goes through or not, I don't know. And so it could be shifting again slightly.
So there's a salary cutoff?
Yeah,
Or,
there's a multi-factor, but there is a salary cutoff.
and so,
You
I
have
think there are job categories for Creighton that are exempt and job categories that are
yes, but
non-exempt.
we set those job categories with salaries in mind.
So what is the salary cutoff currently?
I don't know it off the top of my head.
I'm not sure if it's 50 or less.
It's more than 50.
Okay,
Last
well,
I remember it was around 52, I thought, but.
yeah, now they're talking about raising it, so we'll see if they do.
And so I guess just to clarify, so, any position can be non-exempt. And to determine if it's non-exempt, one of the not just salary, but also
Yes.
looking at scope of responsibility, autonomy of decision-making and what have you. And there is no risk, every position could be paid hourly. There's no risk with that.
That's right,
It's
yes.
the challenge comes if we say a position is salaried and is exempt from overtime when really they should be receiving overtime. And right now then it's if you make less than a certain amount, regardless of the scope of
Then you have to
responsibility,
be.
you're going to be hourly. And they're looking to lower that.
Yeah. Because they do recognize an intersection between the total annual income and likely scope of actual.
So I think that this is sort of cutting through some categories of our staff in our laboratory settings. I think some of our core personnel are paid higher than the 50,000. Some of them have PhDs.
I think the
And-
cutoff is 35K.
Pardon me,
The cutoff is 35K.
35?
Yes, that's what I'm seeing on one website, but
That doesn't
Well,
make
it was
sense.
gonna be raised before and they're trying again.
Well,
And the raise before didn't happen. I've just never paid attention what the dollar number is,
Okay.
sorry.
but then like some of our more experienced technicians, either they come with a lot of experience or they've been here long enough that their pay keeps rising, that those staffers that I think have usually been hourly
Yes.
really should be exempt.
Well,
I don't-
remember, we may still need to treat them as non-exempt because of the nature of the work they do. It's about that threshold of dollars is really more, you can't treat someone below it as exempt.
But if somebody is a staffer who's a lab manager or core facility manager where they have a lot of autonomy in running the core, et cetera, they might end up.
And yes, and so what I will say is, as we've been related to the ongoing compensation projects and looking at job descriptions, compensation is also looking at exemption status. Now, I would say with this first phase, I don't think that I don't know that because the focus was more on the actual compensation piece. But I think that we will continue to look at exemption status and making sure everyone's classified correctly. And I know there's other areas where maybe people are mentioning, hey, this role has been non-exempt. Is that correctly classified and vice versa? So I think it'll be something as we look at job descriptions. And I know this is kind of going down off topic, but I will mention that when you see our job description template, and there's that section that talks about like scope of job, number of people you're managing, budgetary implications, decision-making, that helps inform the exemption status. All right. So with that, assuming people are classified, as hourly, here the expectation is that they're accurately reporting their time worked on their time card for all hours worked. And all hours worked by a non-exempt employee, whether it's approved or not, must be paid. So that is federal law under FLSA. So with that, I'm going to talk a little bit about overtime and then clarify a few things because it's come up throughout the university. So overtime, that's if you're an hourly employee, you will receive 1.5 times your regular wage for all time worked in 1 week, that exceeds 40 hours. Vacation, sick, holiday, that pay is not considered time worked for the purposes of calculating overtime. Overtime should be discussed with the manager ahead of time, and my HR will automatically calculate the overtime hours. What I want to clarify and talk through is the determining of overtime. So I think a couple things. One is, I think in some pockets, there's been a thought that as long as you stick to 80 hours in a pay period, because they're paid bi-weekly. So if you stick to 80 hours within a pay period, it's okay. So if somebody worked 44 hours 1 week, 36 hours the next week, that's 80 hours, there's no overtime. But that's not accurate. It's per week. So if somebody works 44 hours week 1, 36 hours week 2, okay, but they're still going to get 4 hours of overtime pay for that first week. The other piece I know, Dr. Hanson, you mentioned the comp time, and we don't have comp time. And so what that is, and this is, again, it comes up where maybe somebody works 2 hours on a Saturday to help out, whether it's with the research project or some type of student event, and thinking, well, I'm not necessarily going to record that time. I'll use it later. Maybe I'll take, leave early and not have to use vacation or what have you. But the only time you have flexibility like that is within the work week. So if I come in 2 hours on a Saturday to work, I should record 2 hours on my time card for that Saturday. And then maybe I'm working, talking with Andrea, she's my boss, and she's like, hey, Michelle, you're not approved for overtime. So then we talk through within this work week, before Friday, when am I going to take off 2 hours? And so I'm thinking Friday afternoon, I'm leaving 2 hours early. And so then I put my 2 hours for Saturday, 8 hours, Monday through Thursday. I record my 6 hours for Friday, and we're good. But the only time I can have kind of that flex in terms of the hours is within that work week. Otherwise, I'm getting 42 hours and I'm getting 2 hours of overtime.
And so a small underscore, that's why she's made a point of telling us that the work week is Saturday to Friday.
So
Because you have to, starting on a Saturday to the end of that Friday, that's when you have to calculate whether there's overtime.
and
So,
do
so
you,
the challenge I'm having with this is that if we have an NIH grant, there is no provision for overtime.
Right.
So we can't be managing our employees and their time when we're trying to manage an NIH grant. I mean, you're making us into administrative managers when really we should be doing research. So this is an added burden to PIs of an NIH grant.
It is a burden. It is something that you have to figure out how to manage, and I don't know what the School of Medicine, and Jason and Dr. Hanson, what you would say to a researcher who's trying to manage that, because I don't know if it's how you schedule your research so that you make sure you're staying within the 40 hours in a week,
Well,
or if there's any budgetary coverage for someone. I don't know how you resolve that.
we have to resolve it because at OHSU, where I came here from, where I was at for 22 years, you got paid 40 hours a week. There was no overtime, and there was I don't know what they would call it. We just called it flexi time. If you worked 4 hours on a Sunday and you didn't work, so you only worked 4 hours on a Wednesday, that was fine. So it was a lot more flexible. So here it seems a lot more rigorous.
I would say we have that flex time if that Sunday and Wednesday are the same week.
Okay.
Any other comments from administration? No. Jason?
Not administratively, I mean, just as a PI, I mean, that's part of the gig. You just have to manage technicians differently, that's all, versus postdocs.
I tell new hires as they come in that, and I hope that HR during orientation tells people this, right? You have to have approval in advance for overtime, for example, among other things. But I tell them, we're not gonna do overtime. And it's up to you to manage your 40 hours in the week. And if your assignments are not consistent with the time available, or you gotta stay late to finish something, for sure, you must stay late until you finish. You can't walk out on your experiment. That you should let me know, and we will reduce your assignments or find someone to, finish something if you can't get it done. But that it's really on them to manage their time. And if it's out of whack, then we have a conversation.
That's a good orientation for someone starting in your lab is, I can't fund overtime, so this is what I'm gonna need from you.
Yeah, we've staggered them when we've had like really long days.
Mhm.
We'll just have someone start early, leave early, and then our technician come in late, stay late, and
Quick question about the second bullet point and then the third bullet point in overtime. So those seem discrepant. How does that work out where it has to be approved ahead of time? But if the employee goes ahead and does it, they still have to be paid for it?
Yeah. So I would say is the expectation, and I also want to acknowledge, I see we have a question on the phone, so we'll get to that next. The expectation is it should be approved ahead of time. Now, if something comes up or, somebody days late or what have you, and it was not approved ahead of time, we are still legally required to pay it. So the expectation is they should get approval ahead of time. Sometimes that doesn't happen. And then depending on the issue and depending on, if it's, okay, it was 15 minutes on a Friday to wrap up an experiment. They went over, okay, that's one thing. If you're seeing it habitually and they're working overtime and they're not getting approved for it ahead of time, then that's something that we could address with like progressive
Yeah.
discipline. But again, it should be approved ahead of time. If it's not though, we still need to pay it.
So HR and the lawyers will say, did you communicate no overtime was generally allowed unless I approve it ahead of time? What are the facts? Like she said, is it some unusual situation? It's not the employee's fault. Is it repetitive or is it, I asked you and you said no, and I did it anyway? In which that's a level of insubordination. So there's a whole range of factors before we decide.
And I suppose that the way to manage, Peter, I mean, our only way to manage and avoid overtime that you don't have budgeted for on your grant would be, okay, you had to get paid overtime because I had to have you do this, but next week only work 30 hours and only be paid for 30 hours.
That only works within that one Saturday to Friday zone.
But you'd still have to pay the overtime for the week that they had the overtime, and then the next week say, like, my budget's out of whack, I want you to only work 30 hours and it's, you get time and a half versus, is that an option?
I suppose you could reduce someone's schedule, but if it's meant to be punitive, I think you're running a risk.
Well, not punitive, but
Because they don't
this
have
is
to
how
actually
much
work
I
that day.
have. This is how much budget I have, so I.
Or we could spread it out over multiple weeks to
Yeah,
lessen the burden.
So
38
so you're still
hours.
paying the overtime, but then to kind of,
make
when
your
you look at
budget work.
budgetary overall. And I think, I haven't,
I guess the real question here is what is the minimum number of hours somebody has to work to be full time? Because they're employed doesn't mean we have to guarantee them 40 hours a week. We just have to guarantee them the minimum full-time status, right?
so I would say, minimum is 20 hours a week. I think to be benefits eligible. And I would also say though, when I think of like our offer letters, and I just think of like generally speaking, and Andrew chime in here. Our rules here are typically, hey, this is your position Monday through Friday, this time to this time. And so I think, in terms of kind of working this full-time job, I think that's the expectation is I'm going in for 40 hours a week. A little bit different than, okay, if I'm working at a restaurant or I'm working at Hy-Vee and maybe my schedule differs week over week. So that's the piece I don't know that, and this is
If
where.
it would look like a punitive action, so I'll look into that and see if there's a way you can do it. There probably is.
I mean, or if you don't have enough work for somebody,
Then you can say we're not scheduling you, yeah.
And I think general practice is, and like there's ebbs and flows in work,
Mhm.
helping out with some other things or what have you. Just because I think different pockets of the organization of the university have different times when they're super busy. And then other times when, okay, I'm not as busy. And so maybe I'm not in all of this right now, but I'm catching up or doing some other projects or things like that. So I don't know that. I've only been here a year, so I can't say that I've got a full lens into if there's practice in terms of, okay, it's a slow time, so rather than.
There are in some areas, but it's got built into the job that
Okay.
the person knows that they're going to have seasonal shifts.
We have a question.
Oh, yes.
Can we hear that?
Brian, can you unmute?
Yeah, so I have a question. This is, I probably know what the HR standpoint is. It's more a question for the senior faculty. You have kind of two classes of technicians. You have those that are like career technicians. They're gonna come in, they're gonna work 9 to 5, punch a clock kind of, then you have technicians that have larger aspirations, right? They want to go to grad school or medical school, and they want to work more, right? Or, you know, I guess you don't tell them they should work more. You don't encourage them to work more, but you find that they're working longer hours. You might come in on a Saturday and there they are, you know, and how do you best handle that? Because they're seeing the viewpoint of the more they can accomplish, the better their letters are going to be. They might get a publication, which might help their graduate program, their, you know, acceptance into grad school. And then, you know, what's the best way to sort of kind of manage that without destroying their confidence, I guess?
I for sure have great technicians or great staff who like work hard, get the job done. I'm like, wow, you really got a lot done this week. And nobody ever tells me they work overtime. I never ask anybody to work overtime, but
It could be happening.
it happens for sure. If you make it clear what the expectations are and they are like, yeah, I'm gonna end up overtime hours, but I really need to get this done and I'll just, you know, adapt next week. And no one ever tells me that that's happening. That's the way it goes. And it actually makes the lab work a heck of a lot better. And everybody who's been here a while is smiling because this is in actuality how it works. We don't have official comp time. I'm really clear. This is how it works. There's no comp time. Don't work overtime. You know, if you work longer on Tuesday and you want to leave early, absolutely do that. Or you work longer on Tuesday and you've got a doctor's appointment, and you don't want to turn in sick leave, you know? But it just, like, you got a great employee, you got a great relationship, and, we all work together.
I'll say this from the legal perspective, which is, I am aware, because I've gotten emails from hourly people into the evening hours. And I can guess, and even have had conversations where it's clear to me that they're working extra hours. And I always say, and if you were a manager, if you said you cannot be working overtime, you should not be putting in hours in excess of the 40 that we're paying you. If you are clear and you're not turning any deliberate, obvious blind eye to it, you're not creating a liability for us for wage and hour violations, which is a hidden risk inside there that some agency is going to say we were doing something dirty.
Yeah.
But that would be what's critical. Can you prevent it for the person who says, you know what, I'm just gonna take this little bit of work home, do something, I'm just gonna send it out during the day, no one's gonna know. Yeah, there's gonna be that person who's trying to look like a star, doing something extra. Question is, are we being abusive about it? Are we
But
deliberately turning a blind
yeah,
eye?
and I don't want to, and I think generally people do just say, hey, I'm leaving early, I worked a bunch extra.
Yeah.
And like it evens out, but I think also the nature of the work is not 8 to 4:30 because, and I think most of us, you know, some people come in earlier,
Yeah.
some people come in later, and there are long days and there are short days.
And
So,
that's fantastic
so,
inside of a week.
you know, sometimes it's a 9:30 to 6 o'clock person that has car trouble and doesn't start till 10, and they're sending you an email.
Yeah,
6 o'clock is part of their workday, or we know this has to be long and I'm gonna come in late because I'm gonna come in late
Right.
tomorrow because I had to get this done.
right.
So we do not. I mean,
That's
the-
perfect
the work
inside that
is
week. Yeah.
not- The work is just not 8 to 4:30 most of the time.
Right, right. And that's fine. And it's up to a manager to make sure that they are being careful to communicate responsibly around that 40-hour week and using comp time within that week. That's one obligation. And to the extent you are allowing that flexible schedule, being equitable with respect to the way you manage that. So you don't hold Jason to a tight schedule that nobody else is held to.
Mhm.
Because then you could have an inequity argument, especially if it ran across a protected class line.
Sure. There are some job categories where you have to keep to more of a schedule than others.
Yes,
But that's a That's not an
Yes.
equity, that's
Mhm.
the needs of the job.
Right.
And I think for me, the difference here is that so long as it's within the work week, not in the pay period, which is 2 weeks. But it was 2 weeks at OHSU, but here it's
It's-
within,
yeah.
within the week rather than the 2 weeks in Oregon. Okay.
So that's a Creighton rule, not a federal rule, that it's a 40-hour week and not an 80-hour 2 week?
I think it's a federal rule that it's within 40 hours within 1 week.
And it could be that during your time there, whether the state was meeting what the feds would say, or if the rule shifted, this is where we're at. All right.
What if the
Well, I guess
employee
one
said, I want to work on my own time?
That there's no such thing for an
Right.
hourly worker as their own time.
There's no such thing?
No,
Okay, so we should not approve this kind of,
you should not approve that.
okay.
I guess, do you guys have anything that we can send to the hourly worker? Like telling them that we have a budget for research that we can't afford to pay you overtime.
You can say it that simply, that that staff in this lab will not be approved for overtime. You may not work overtime.
And
For
then,
any reason your
Well, I
work
guess-
is exceeding the work schedule, or you anticipate the need for overtime, you must
guess
get
kinda
it
going
approved
back
in
to that-
advance. Go ahead. Brian?
So going back to that, I think it's kind of like, I think Dr. Hanson made a comment like, you talk to your employee, you say, we don't have a budget for overtime, so you're not going to get kind of overtime. But then that's a verbal communication. And I'm kind of wondering if that's sort of a standpoint that us as lab managers have, where we operate under a pretty tight budget, should we have something more in writing in that so that, so that you don't get caught? Because I think I had an employee that was with me very temporarily, who, I would basically say, you can't today, and then he would just still stick around for like an extra hour, and then he would put it on the timesheet, and you're kind of like, you're kind of like, well, what the heck, and I kind of wonder if there should be, like you said, it could, like, what happens if you have an employee that's really just a go-getter and does put in some extra time? They don't actually document it on their card. They don't tell you. You don't really know, right? I don't go in at 7 in the morning on Saturday to see who shows up or not. But then, like, what happens if down the road they're like, well, I used to work like 50 hours a week in this lab, and then all of a sudden something comes back, to haunt you.
Okay,
There's a lot of verbal communication that I kind of wonder if there's some issues that could happen down the road legally.
so, remember in the, earlier, Dr. Hanson said when she orients her employees to her, lab, she says in the beginning whether she will allow overtime or not. If you are consistent in your practice and you say, I say this to everyone, that is, something that we would take into consideration as proof that you had communicated it. Is it better if you have a little list of written lab rules? Absolutely, it's better. And we'll talk about that in advance. I'm also okay, and we can talk about this, or we'll talk about it later, but documentation, you can document some conversations to yourself that, or if you do it that day, that can be a record that matters, whereas and why do I say that? Because let's say I need to talk to Garrett and I need to correct him a little bit, but I don't want to make it a big formal issue. If I just write a note to myself on August 31st, I corrected Garrett. If it ever becomes an issue again later, I've got my contemporaneous record, which proves I did something. And and I can even email myself. So we can talk about ways a manager can be consistent and effective without necessarily making a performance improvement moment that raises it to a higher level. But if you have an orientation checklist that you go through, that can help you establish that you did communicate this. But if you have the person who you've said no overtime and they're submitting it, that's when you need to go back to your HR generalist and work through a progressive discipline process.
So I happened to consult with a fabulous former technician who was one of the ones that I would have suspected that they were giving me more hours than 40 hours a week. And I think this actually was probably back in within a pay period comp time situation. But I had opportunity to consult with that person who told me that, no, they pretty much, they were really good. They got all this work done, generally always within the 40-hour period.
Yeah, you're gonna have a star.
Great to have the perspective. So,
Yes.
I mean,
Yeah, yeah, as a tech, I mean, I think if, as long as the expectations are clear, then you just work within those
Yes.
hours, I mean.
Yeah, and
That's
so
what it
bring in
is.
your generalist if you're having some issues and they can help you shore up some of the communication and maybe some follow-up if it's really needed.
I think Brian brought up a good point of someone's working overtime, but not having it, putting it, entering it in the time card, but then trying to call it up later.
Later.
What's,
So
mean, are-
the way we will approach it is, do we have documentation about the communication? If we don't, we may have to pay that.
but why
I mean-
isn't there an assessment of you didn't document it? So why do you
We have
think
had
you're?
situations across this campus where people did not communicate the restriction on overtime hours. So the university from
But
a
if the
labor,
employee's not documenting on their time card and then trying to come back later, that's the
it,
crux
it,
I'm asking
it can
about.
still be a problem for the university, and so we will have to pay that. That's why we do want managers clearly communicating up front, so that it is not an allowed practice.
I think it would.
And
help.
if they're watching if they have a capacity to see the work happening and saying, wow, I was getting work at 10 o'clock at night and you were ignoring that fact, you're creating a potential problem, depending on whether you had an ability to see that work happening. If they were hiding it from you, you had no capacity to see it happening,
You see,
go ahead.
Yeah, I think won't this be something the HR should cover during the orientation stuff?
You know, I can make a note of that. What I will say is currently, all right, so new hire orientation facilitated by HR is the first Monday of a month. So it's not, necessarily somebody's first day of employment. And in the orientation as it is today, it's really covering more about there's a section on mission and ministry and Title IX and things like that. And there isn't, so this is a good point, I'll take it back, but there isn't anything specific to filling out your time card. And I know, and I can go back and look at, yes,
This has to change, I'm sorry.
okay.
Fair point.
Yeah.
Yeah. She and I will both bring that back.
Yeah.
So,
Yeah, I mean, the mission and ministry thing, I mean, we're hiring technicians.
well, it's,
Well,
yeah, and it's the same.
None of us are gonna win an argument on that point. So that will still be an
Covering that, but
orientation,
not
but we
this. I
ought
mean,
to
this is
have some
ridiculous.
very key basics in our,
This is
and maybe one
unacceptable.
for exempt versus non-exempt.
Yeah, so what I was going to say is right now it's one orientation that all new hires are invited to. Also, again, it's the first Monday of a month, so depending on when somebody's hired, they may already be here for 3 or 4 weeks before they go to that new hire orientation. And it's, I think they continue to, adjust it, so it's like 3 hours or what have you, but yes, I will provide this feedback, but I will say currently it is not.
Right, I mean,
covered.
I have one taking.
Yeah.
One.
Yeah.
Technician starting, so, I mean, they're gonna know about the mission of the university, but not that they can't work overtime.
Mhm.
And that doesn't make any sense.
But part of it is though, what I will say, again, I will pass on this feedback, but there are certain things too that as a manager, if you kind of go over when they start start, because when you guys talk about all these nuances too, in a setting where you have people from across campus, across roles, the nuances between what somebody does in facilities versus what's expected in the
Yeah.
lab are going to be different. So I'll make a note and follow up in terms of covering it, but in terms of expectations or what that looks like and schedules, like I still think that's an opportunity for a manager to have that conversation.
And unfortunately, one of the real realities here is there are departments that are allowed overtime because of the nature of that department and the duties that people have. So as it is, it's gonna require going back to the department and saying, am I allowed overtime or not? We can't put that burden totally on them, so we really have to put it on the managers.
We can communicate that, should be approved in advance, but,
Yeah, and if you haven't heard approval, the default is it's not. We could try to work with something like that, but we might need a policy. And
we have
clear
guidelines.
communication. we'll talk.
Okay,
We'll talk with HR.
but what I will also say, one more thing is we
It's
put
still
together,
there.
oh,
You never
Brian,
that's
I
always
don't know
there.
if Brian still has his hand up or he's got another question.
This is a hot topic.
Yeah.
We just had a session on this.
Yes.
All right, maybe we should move forward.
Okay, oh, but I'll just mention, we have, kind of on the manager toolbox, under welcoming your new employee, there is a resource in terms of things to do, like for onboarding, before they start their first day, their first week, the first 90 days. I'll go back and look at that, but I think part of it is like talking about, all right, expectations for work shift and things like that. So, all right,
So there's a live orientation for new employees. Are
Yes.
there any recorded sessions that could help with things like
that's a great
how to
question.
fill out a time card?
That's not a bad solution
there
that we
is-
could have a pick and choose.
The recording that I know of, is for managers. No, yeah, because they actually have moved, I think you're probably familiar with Bridge, the trainings, kind of some of the required trainings. But that's also the trainings on the learning events. They are then saved on Bridge. And so, for example, a lot of the benefits piece that has moved, I think now it is online where Lenora does her overview of benefits, and that's, the link to that is provided to new hires. Because kind of the same thing, if you're not going to orientation till 3 days later and you have 30 days to enroll in benefits, you need that information sooner rather than later. And so maybe then kind of the payroll, timekeeping, maybe that could be a recording that's good.
I've got it written down, so.
I think that
Okay,
was
got it.
help
All right.
manager to
I'll do
say,
notes
"Wel-
for you.
Welcome
Thank
to your
you.
first day, watch these 3 modules and then
Yeah.
we'll talk.
Yeah.
Yeah,
Uh,
yeah.
Yeah.
You can't work over.
yeah.
That's-
Yeah,
Yeah,
Just need little signs posted in the labs.
I
Yeah.
double checked the welcoming you a new hire, you didn't mention anything about the overtime in the
Yeah.
checklist.
oh, it doesn't have it in there, does it have, okay,
No, no
okay,
overtime.
does it have anything about work schedule?
Works.
Or like hours, like kind of from the,
It only said hours of work, but
yeah, so,
didn't emphasize the overtime thing.
yeah, the fair. All right.
okay, all right, and again, that's intended to be, used for,
Yeah,
All
it's a
place, but-
broad
yeah, so
Oh,
but
yeah.
this is,
Can school medicine have a
Yeah.
specific,
checklist.
like new employee orientation, like specific to school medicine?
Even that, I wouldn't be surprised if there's somebody working in the school of medicine who, we can't rule it out, but you're right, we could have a checklist for people that managers could.
Research jobs.
or
Yeah,
even, I
or-
think,
For research jobs, or if overtime is approved, here's a checklist, that kind of thing. We could have a little bit more of a cut and paste.
Because we are at risk at this point. It
Yeah.
looks like,
Yeah.
like if somebody work overtime without telling us, and then, I mean,
Sure.
technically they should be paid, but we have limited budget.
yeah,
And maybe it's better for us to hire exempt employees, or
Well,
that's-
certain work. it's
that
not-
doesn't have the
Yeah.
overtime work.
and that's where it kind of comes back to making sure that they're appropriately classified as exempt or non-exempt, so,
So all postdocs are exempt.
postdocs are exempt,
Okay, that's good.
Right.
all right,
We are working on some onboarding. It's part of our strategic plan within School of Medicine. So please know that we are taking good notes on this, and onboarding should be coming out maybe within the year for something, something like this.
Thank you, Jessica.
it's wonderful. All right, we'll be a race to see what's done first, the onboarding or the NAVX policies.
There you go. Oh, no,
Okay. All right, the other piece, all right, one more thing, and I just mentioned this, we don't have to go into this too much detail, it's just about breaks. In terms of hourly employees should take an unpaid meal break and where they're relieved of their duties. Typically, it's anywhere 30 minutes or an hour. And the university does also provide the paid breaks. So, all right, we can move right along. This has been great discussion and I appreciate the questions along the way. Let's see how we're doing. All right. Are we ready to go into best practices and communicating?
we
Or
need
should we
to
do like, take a break?
I mean, we do have our lunches, so we could pass the lunches out and a little
Yeah.
pause.
Yeah,
Or you can keep talking and we'll pass them out. as you
okay.
talk.
okay. I mean, I can talk through a lot of things, so yeah, let's go. All right.
I'll just be discreet.
Okay.
I have a list.
All right, so, you know, some of the expectations, I think these kind of build on, and we've touched on some of these, even just talking, you know, the flow of our conversation about, you know, overtime and wage and hour. So, you know, the expectation really as a manager, we're looking to managers to communicate clearly and often and really help set the tone for the team, for the lab, have regular conversations. You know, they can occur in various ways throughout the year, right? Sometimes they're just informal check-ins all the time or informal dialogue. Can be structured one-on-ones. And, you know, we've also had some information in here, the manager check-in guide really kind of helps maybe set the stage for some maybe quarterly discussions about performance. You know, how are things going? How are they doing in relation to their goals? Where are they struggling? Where are some challenges? So, you know, and I think this has come up, the bottom statement there is really, you know, communicate clearly with your team regarding expected work schedule, how and when to notify you of planned and unplanned time off, and the expectations regarding lab protocol, documentation. So some of the things that Andrea, you'll talk about later. So it'll be good to communicate that. All right. Let's see. Okay, there we go. So I will talk a little bit about performance reviews, you know, in relation to managing performance. So staff again, this is focusing on staff for this piece. So staff performance year starts July 1st, runs through June 30th. And so we are in that point of time right now, where staff members can enter their goals in MIHR, really looking at 3 to 5 goals. And then, you know, there's the rest of the timeline in terms of ongoing throughout the year. And we encourage, and we know this doesn't necessarily always happen because we're all get busy, but do encourage there to be check-in conversations, you know, maybe quarterly in terms of how are your employees performing in relation to their goals, you know, and also knowing things change, right? So maybe something that was a project has shifted. So maybe you need to update goals. And really the thought there is you're having conversations, you're seeing what challenges do they have, or are they doing great? And so that way, then when you get to the end of the year and you're evaluating performance, hopefully you've had conversations along the way, there's no surprises, and you're evaluating the performance on the totality of the year. In terms of goals, some of this information, so there is, you know, I think on the screenshots, you know, there are a couple trainings about setting goals, how to enter them in MyHR. The purpose of today's conversation, we're not getting into the mechanics of entering things into MyHR, but really trying to focus on, you know, some of the conversations around that, setting goals. And so the goals, you know, some of this information too comes from Julie Olson, has done a training on setting goals and evaluating performance. So a number of these pieces come from those trainings. But for goals, you're setting the stage for what are you looking to accomplish, what needs to be accomplished over the year. It can be a combination of, is there a department-wide goal or, you know, a lab-wide goal, you know, to tie into the overall university strategy, tie into the unit, you know, to the department or, you know, lab specific. And there can also be a developmental goal in there as well, in terms of maybe building certain skill sets or what have you. The 3 to 5 goals should be SMART, that's specific, measurable, achievable, relevant, and time-based. And, you know, again, as a manager, you can set a goal that says, all right, for my team, like everyone's going to have this particular goal. And that may or may not be as applicable, you know, depending upon the team, the lab, the roles. Maybe everyone does have very unique goals. And there's a couple, again, I just mentioned the resources. I think I'll add the link. I think these were intended to be links to the trainings and it doesn't look like that. So I'll update that. Any questions about goals before we move on to providing feedback? Okay. So I mentioned at the beginning of the conversation how we had members of the EDI team facilitate a session. And so they presented on effective conversations and feedback in May. So it was Becky Nickerson and Stacy Rafferty. I don't know if any of you know them or have interacted with them. So certainly that training is out there. You can watch it. For the purposes of this, I just highlighted, all right, here were the principles of giving feedback, and then we'll talk about the principles of receiving feedback, because all of us, you know, as managers, you know, look to give feedback, but then also we all report to people. We, you know, work with people, we have direct reports, you know, it's also important for us to receive feedback too. So giving feedback, have a clear purpose, speak about the behavior, not the person, be specific, include examples of the behavior. I think that's very important. Suggest or make a request for their future behavior. And I think number 6, I really do want to highlight, give feedback promptly as the situation merits. So if there's a performance issue, something comes up, and, you know, I think you can, whether it's that day or if you have a one-on-one schedule the next day or two, you know, but I think it's important to give that feedback in a timely manner. And then, you know, where it says number 5, I kind of skipped over about ask questions about their experience. You know, I think sometimes depending on the situation, it'd be, hey, here, this is what I've observed. Tell me about it. Tell me your perspective, and say, okay, here's the expectation moving forward. And again, then it's about the behavior, not about the person.
So quick question
Yeah.
about goals and feedback.
Sure.
Things change in a year. What if
Yeah.
something very substantial changes and you want to establish a new goal and not wait a year to do it?
You can do that.
It can be done in the system without getting into the nitty-gritty of the system.
It can. And I think that's a great point. And so, and I think then if you're having those dialogues too along the way, and if you think about it, being able to, okay, this was in place, and maybe now instead of having it be all year, you can determine one of the previous goals, did it stay and it just ended December 31st, or did it completely go away? But you can absolutely add goals and edit them along the way. And I think if you're having those conversations throughout the year, then that also helps set it up for the end. Yeah, so it's editable throughout the year. And I think the communication went out great today. The goal, you can go in now at this time to start entering goals for 23-24. All right, and in terms of receiving feedback, you know, listen to the other person, be open to what they're sharing, give it thoughtful consideration, be aware of your body language and facial expressions. Reflect to the person what you were hearing to ensure understanding, and thank the person for their feedback. So I know sometimes, you know, this can be something that I can work on. You know, I think it's always an evolution, but it's important to be able to give feedback as well as receive it. And then kind of then building into this, I know, Andrea, you mentioned this a little bit earlier about progressive discipline. So each situation is addressed on an individual basis. And so I know, you know, there's things we can look at more broadly, you know, in terms of what's typical, you know, what's been precedent, what's typical approach, but every situation is going to have its unique aspects. The focus of progressive discipline really is to communicate the expectation and anticipate improvement, right? Or for the intent of somebody to improve, but also then clarifying, all right, these are the expectations if it doesn't happen. So these steps, some steps can be skipped, but just for awareness in terms of, you know, what can be included, coaching conversations. So those are really the conversations you as a manager should be having along the way. Then there could be a verbal warning, performance improvement plan. I probably should have put that off to the side because it doesn't necessarily have to go. Performance improvement plan, I think, is when it's really performance-based that you're looking to address, maybe in terms in some of those performance deliverables, where I think oftentimes some of those written warnings, final written warnings, can be more about maybe behavior. Are there attendance issues? Are there, you know, insubordination issues or what have you? And then some things can result in termination. Steps can be skipped. You know, it depends upon the situation, the egregiousness. And sometimes steps can be repeated because let's say we had some conversations, I've documented that we've had, you know, we've coached, then maybe it went to a verbal warning and then things are great. And then a year later we have a relapse. Well, is that necessarily going to go to a written warning? You know,
It'll be fact dependent.
Yeah.
So in here, goes back to my earlier comment that some things we don't write down necessarily. But a written record can assist us in proving that we've already done an early stage or that this is a repeated but not very common behavior. Maybe I'm not late every Monday, but I'm measurably late once a month. Somehow it's a regular problem or often enough. And so now the fact that you've had this happen before, it can help you if you've been good at your own files. Now, Jason always has his notebook with him.
Yes.
Whatever's in there, only Jason knows.
Oh, I don't know what's in there.
Your own handwriting.
Wait, what day was that? When did I put that?
If I have individual sheets of paper where I've written something down, that might not be as persuasive as we can prove it was contemporaneous as if you have like this daily journal. So it's now flowing and it's clear that what happened October 1st, there were other dates, October 2nd, 3rd, all the way through. And then now there's something in late. Yes. So Dr. Hansen has the same thing. Everyone has a different way. I've had people who say, I email myself. And then you now have two files you can drop it to because you have the sent and the received email. So one could go in the Jason Bart's problem file and one could go in a different topic file because you're keeping track of a topic, not about a person. So there are different ways people do it. Both those two are two of the best documentation systems I've seen because we're all pretty fast with our phones or our devices. And so those are two really good ways to establish a record keeping system that works for you. But that is an important part of building this. One of the biggest fails we get is, I have a problem employee, I'm done, I'm ready to get rid of them. Okay, so where's your documentation? I don't have any. And I gave them good reviews every year. So now no one has any record to build it's ready for serious discipline.
So if I just write records to myself, it will also work, even
That
if the
can
one
be
side of
very
the
valuable.
story.
Yes, it will. If you're ignoring something that needs to go through a progressive discipline process, you're still missing an opportunity to connect with HR and build to that progressive discipline process. But yes, that will give you documentation that helps with building that case so that we can maybe, even though they're small violations, they're stacking into something that's serious.
And I guess what I will say with that is it's if you've had that conversation, right? So you're like, hey,
Yeah,
you
you've
know,
got to
talk to
communicate.
Michelle about this, you know, late again, you know, what have you, that is
Yeah.
sufficient, right? But if you just say, okay, I've observed it, but
And
not
done
necessarily
nothing.
haven't talked about it, that's not as helpful.
Yeah.
And I want to say this is for good stuff too. So when I'm thinking about kind of like this whole, you know, if you're having conversations, you're setting expectations, you're providing feedback along the way, you're having at some point some formal one-on-ones, you're documenting these things, whether it's, you know, a note to file, email to self, whatever that looks like, then, you know, when you go to do a performance review, you can go back as well and look at, okay, what did we talk about? What have they done? You know, because sometimes when you're going to do that in May, it's hard to remember what happened in August. And so you've got it all there, the good, you know, the feedback provided, improvements made, as well as if those improvements haven't been made despite the conversations, despite what you're doing, and you're setting the stage then in terms of if it needs to go down the route of progressive discipline.
And I think tracking the good stuff is important.
It's
when,
huge.
if you have a staff member or someone you manage that you want to give more than the average raise to, it's easier on a grant budget, but if it's a university paid position, you're going to be asked for some documentation for why they should get bigger than the designated raise, or you get somebody where it's at the point and you want to make a case for them getting a promotion, basically, you know, to a higher level staff position. Having all that documentation would be part of that. 'Cause,
It
yeah.
also helps prove that you're not that you're treating everyone the same. So you might be focusing on one person's performance or whatever it is, their consistent failure to clean the lab. But you show that the reason you're disciplining that person is because it's rise to a threshold that the next person has only done it once or twice. Because one of the biggest things we hear from employees, well, you're not holding Peter accountable, you're not holding Michelle accountable, but you're holding me accountable. But you can then say, I've consistently documented more problems with one employee than the other. And that's why there's a differential. And like you said, it gives you documentation to support the positive. Even if you're disciplining me, but you can say, I'm being fair to her because I've highlighted these good things she's doing, but here's where she's falling short. And so so you're showing the good and the bad. It doesn't hurt you to have good about someone that you are spotting as a problem employee.
Yeah, and I like documenting good as well as when you have the technicians who are super ambitious. And you know, in a year they come in your office like, oh, I want to go to medical school or graduate school or law school or wherever it is. You can go back and look and it's like, oh yeah, I forgot about this awesome stuff they did when they first started. And when you write your letters,
You've
I
got
think
me.
it makes you, it helps you write a stronger letter.
And
Yeah.
all of this is true for our graduate students. I mean, the
Yes.
good and the bad and the documenting part.
Mhm.
Yeah.
All right.
Okay.
So one comment on there, I take that verbatim, the words may include. What if you had a situation where somebody did something more egregious, like professionalism?
Then you skip steps.
You can go right to like a written warning.
You can go right to termination if the events are serious enough. And that's something that everyone should understand.
Yeah, and it's, I think for the new people here too, it's something you need to think about now is what are things that are like totally unacceptable to you in your group? If you found someone was making up data, I mean, just what are if this happens, this is gonna be my response versus this happens, I'm really upset about it. Just having kind of thinking these things, doing thought experiments. Yeah, this is how I'd manage this type of behavior, but if this or this occurs, I just can't trust the more words than the story. I think thinking about that beforehand.
Having your own DEFCON levels.
Exactly, no, exactly, yeah,
Yes.
yeah.
And with that, you know, the progressive discipline, the templates are not out there. I mean, so it is, in terms of, you should be working with your HR person to go through that. And certainly I would say anything that involves termination, HR, we work with general counsel on. So, and one thing I would like to mention too is I've also seen, and I think it's important to be mindful of, when there is something where it's like, all right, we need to skip steps, is I'll also often have conversations because sometimes if you go too aggressive too soon, then there's another mistake or a little mistake and it's, okay, but we've already done a final written warning and now something happened and is this really termination? You know, so kind of trying to find that balance in terms of how do you address the seriousness of it, but also continue to set the stage that, all right, you know, for whatever may come again. So like, no, this time it's your second final warning and we really need it. You know, I want to avoid that because I have had that happen. So.
Are we
Alright.
managing our time okay? We have,
We're probably getting a little close, but
Yeah, we'll go through, I mean, because we're
I think
just
we
going
can
to
move.
12. All right.
we've had a lot of discussion already.
go
Yeah.
ahead and meet people. You
Yeah.
better eat.
So this is where, Andrea, I'm going to turn it over to
Sure.
you to talk about navigating complex situations, as if we haven't already.
We made
Well,
12
not some, but now we're getting, if we cannot wage an hour, I can't wait to see what FMLA brings
Well,
up.
okay. So one of the things that we see regularly at Creighton, certainly we do see people taking FMLA. This is a federal right, and this right says you have protected time. So up to 12 weeks is what FMLA promises on a full-time employment. And Creighton has set the bar a little low. You have to have worked 1,040 hours in the last 12 months. I think the federal 1250. So we're a little, that's the only real variation we have from the federal right. But the core of that right is something that's offered under federal law. But when you're getting into an FMLA, you also may be getting into a disability accommodation issue, including that can technically extend the leave past those 12 weeks. So let's say I'm at my end of my 12 weeks and my doctor says, you're not going to be cleared for a couple more weeks. It may be that I can get that extended through use of another law, the ADA. When you're talking FMLA, This is when you really have to intersect with HR, both the employee needs to and the manager may need to, because there are layers to this onion. So FMLA protects the time, but what pays for that time, that employee's time, can range from sick leave, use of vacation, there could be parental leave. There could
Short-term
be
disability.
short-term disability, long-term disability, and there can be unpaid time. Availability of short-term disability is if the employee's paid into it. Long-term disability, thankfully Creighton now offers that benefit, so we all get that benefit. But the intersections of how everything plays together is complex. It is extremely fact-dependent. So you're gonna, as a manager, you're gonna end up roping in HR. But as an employee, that's a resource they need to intersect with as well. So they
Sorry,
end up
Andrea.
working with them both.
I think our, like, maternity leave would end up getting charged to a grant. Paid maternity leave part.
Paid maternity leave is something Creighton pays for, whether the
I
grant
don't know the
funds
funding.
it. That's, I can find out the answer to that, but I'm not sure that that's always funded by a grant.
The
I think it
parental
will, I believe the federal government generally pays for time that we'll cover as a benefit.
Okay,
And so that's why it might be paid.
okay, thank you.
Yeah, that would be for Lenora. And what I will mention in terms of, again, this is an overview. But Lenora Salt, some of you have probably worked with her. She is our benefits expert, and she's really then, if there's questions about FMLA, like you could come to me in terms of, hey, we've got this going on. I could confirm, is this person eligible for FMLA, or is this something maybe that's worth pursuing? But in terms of the actual FMLA, getting into all of the details with that,
Yeah.
we've got Lenora.
And so, and Lenora, even if the calls first go to her, she's probably gonna be bringing in that generalist to make sure there's nothing unique about the job or the department that she needs to be aware of and understand. So it is a conversation that becomes a team conversation. Next one. If we can. So when we're talking about these accommodations, we do have these resources that we've got, including an accommodation request form. And there are a couple things that I really want to highlight about a disability accommodations. And one of which is that it is an interactive process. There are accommodations that we're used to that are very regular. And so like with our students, extended test time, it doesn't usually require an extensive interactive process, but there can be things that are very unique. And what might seem to work in my job before, I might need something else worked out with my new position. And so that's when that interactive process works out. Service animals work in some environments, they don't in others. So it can end up being, what other tools do we need to give an employee because a service animal doesn't work in a sterile lab, right? That interactive process is with HR, it's not with the manager. HR brings in the manager, but they're the interface. So it's not direct with you. If someone's asking for an accommodation related to their health, you send them to HR if it's anything other than today. Okay, so examples, and I think we might have them on a next slide. I can't remember if we do. I think it's, yeah. So if it's a recurring health condition or one that's potentially, I've got a migraine today, you can say, fine, go home for your migraine. But if you're gonna be having these, if this is something that you regularly get, go to HR so that you can get approved for flex time
For FMLA.
or FMLA. Request for changes to my schedule or equipment that I need. Here's a great one. I need an office close to the bathroom. Manager might have an open office and says, that's fine, you can have that office. I can put you there. But if you need that as an accommodation, understand, I'm doing it informally now. If you need it as an accommodation, you might want to go to HR so it's part of your documentation. See how there's that differential? And then if I disclose a health issue that could be potentially impacting my performance, by all means, I'm going to recommend you go to HR. If anyone just discloses a health issue to you and it's not impacting their performance, say, if it is, if you think that health issue could, go to HR for anything you might be needing. So that you're just always, that's your habit. so you don't forget to do so. Now,
And can I just
Go
plug
ahead.
in two things real quick?
Mhm.
The links on the previous pages,
yes,
this has just been updated. I want to say kind of went live, within the past like
yes,
month. So this is
our
new
process has
information.
changed
Yes.
slightly.
Yes. And there's a training coming up specifically about like, I think is it FMLA and leaves and reasonable accommodations this fall. So it's listed out on the upcoming event. So there'll be more
Yeah.
information forthcoming if you're interested.
And then that middle one. This is one of my highlights here is really around the health documentation. I may really like my supervisor Garrett and bring him some doctor's note with some information in it. If it's about accommodations, Derek, I just had it right, Garrett should be sending that and saying, no, give that to HR. But even if I'm willing to share with Garrett, that is information that I am getting through this protected process around accommodations. And I'm not sharing it with everybody necessarily. So my manager should not be telling everybody else the content of my health information. When HR, with their new documentation process, tells the manager Garrett that an employee in their lab is getting accommodations, they won't be saying the why unless they absolutely have to describe the why, or they have permission to describe the why. But that still doesn't mean Garrett gets to share the why with the rest of the department. Garrett's supposed to share what he has to share, which is Andrew's gonna work different hours, or if he really needs to share that with everybody. Or Andrea's gonna be doing something slightly differently. That's where he leaves it. It's up to Andrea to decide to share that. So please try to respect, and if you have someone that you think is chatty, you say, you're free to share, I'm not gonna, or tell me what you want me to share. Because everybody has their range. And one of the things I've seen people trip on is, wow, I thought Andrea shared the sun, moon, and stars. But apparently she left one moon off the list of what she didn't want to share, and I tripped into it and shared it. So it is safer for a manager to let the employee define their scope of sharing. I think that's all we need on that.
Yeah, that would-
So Title IX. The university is covered by Title IX, which is a federal law protecting students and faculty and staff from discrimination on the basis of sex. Our Title IX office, we have a broader title, we include civil rights compliance. So this is the office that supports and investigates regarding harassment and discrimination, even if it's not sex-based. So next slide. They, Creighton prohibits discrimination on protected classes. This is national origin, color, race, veteran status, sex, sexual orientation, sexual identity. So a broader class there, and religion, citizenship status, gender expression, I think is the better way, and marriage. So whether I'm single or not, divorced, my marital status is also protected. This can be unfair treatment. It can be unwelcome conduct based on one of these statuses. So next one now. Sexual harassment can be everything listed here. It can be within our programs, on campus, or on property controlled by us, and anything happening within the United States. So if I am traveling with someone that I work with or one of my professors, then all of that can apply.
So if you go to Canada.
Go to Canada or the DR. Because we run that DR program, we will still include that in ours, but it's not federally protected. So we would still fall under other policies. Everyone in this room is a mandatory reporter. And what that means is if somebody tells you they are experiencing something, or if you witness something that falls potentially under the scope of disruptive behavior, concerning behavior, dating violence, discrimination, harassment, sexual violence, stalking, or other crimes or other concerning behaviors, you're supposed to report that. Your first stop is Title IX, unless there is an immediacy to it. And then that's a public safety kind of issue. So if you think something needs to happen fast, you've got you've got public safety as your better resource. But Title IX is your mandatory. You've got multiple ways to do it. You can just simply email title9@creighton.edu and you're done. You've met your obligation. You can call the 3189 number and talk to someone in the office. We also have the Phoenix email address for folks who are located in Phoenix. I know you've got a question. You're supposed to do this. This is honestly one of the oddest things that people who I have directly said, now remember, you're supposed to report this. Within weeks, they're not reporting it and they're coming to me instead. And I'm saying, remember, you've got to call Allison Taylor. You've got to call that office. For some reason, this is not mentally clicking with people. So I'm highlighting it here to remember, if I use certain magic words, I'm feeling bullied. I'm feeling threatened. He's harassing me. You might know he's harassing me about my cookies. You know, no, I'm not using that in an illusion, but he might be harassing me to steal my dessert. And I don't mean it that way. But those magic words, you can plumb the depths of that conversation and say, do you mean he's harassing you because of something more than just he wants your dessert right here? And someone may say, well, he seems to only do it to me. That's enough that you should be saying, well, you know, I'm going to have to report that. It's up to you whether you do anything with it. But you can also refer people to that office. Referring someone is not replacing your mandatory reporter, but it's an important thing. When someone brings those conversations to you, you don't say anything other than, remember, we have this resource, okay? You don't judge it. You don't say, well, that's just the way Bob is, and discount it. You don't immediately have to agree with it either. You can say something, I'm hearing you. It looks like this is a bad experience for you. You don't have to reinforce it if you don't want to, but you don't discount it. You refer them, and you can even let them know that you will be reporting it because you're obligated to. No one in this room probably has the kind of privilege that keeps you from ever having to. We have priests on this campus. If it's in a confessional, then that exempts them. Our counseling center and our VIP center are pretty much our private places where those people have some exemptions that apply. But Peter, you had a question.
So my question is does this only apply to reporting behaviors that affect students, or can we report behaviors that affect other staff?
Absolutely. Faculty, staff, anybody in our community.
I wish I'd known that 4 years ago, but thank you.
I understand that. This is something that you can report. And actually, we love it when people do, because sometimes it's one little moment and that person doesn't want to say any, or doesn't really want to take action, but they do want to build on other claims. And maybe they'll feel comfortable if they realize they're not alone. But also you could be helping someone go forward. So sometimes it's the volume of small things that builds to something more serious. So next slide. Sure.
Ask a couple
Mhm.
questions around that.
Yeah.
Because I encounter all sorts of situations, in particular with our students.
Where they say things.
Yep.
Mhm.
And I have referred people to the Title IX office.
And then nothing happens.
Well, but the very fact that I've referred them there means I would mandatorily
Yes.
report it
Mhm.
or along the not. But my interpretation, you can tell how if necessary. My interpretation is that the mandatory reporting is in particular around sexual theft in Title IX.
Our policy, and you can go look to that policy that was linked there, says any of those behaviors. So I know that's, there's gray zones. The mandatory reporter was updated in the last year to make it more clear that if it's any type of harassing, bullying, threats should be reported. Now, what happens to that? And they talk about what you should, like what goes to public safety versus the Title IX office. The Title IX office may not be able to do anything if that person doesn't come to them, right? But sometimes what we can do is we say, wow, we see a pattern of a problem in an area, or with a person, and we find other ways to intervene.
That's why I
Yeah.
encourage them to go to the title.
You
IX
encourage them to go
office.
there, but you just write your simple email and they will be looking at it from an environmental perspective, as well as maybe targeting some additional training. So I'll give you an example from years ago, and it wasn't your school or college. It was not medicine, but we became aware of somebody whose text messages to staff were extremely derogatory towards a certain class of student. And we had an opportunity to do education, and we wove that into that education. And I know it hit home because I was the one doing that education. And I saw the looks on a couple people's faces where they suddenly are thinking about their text messages. And their body language, they didn't hide in that meeting. And I knew, I think we just made a shift. And the complaints ended. So it can be, sometimes we're bringing it in to training in a way that helps everybody learn from it, but maybe it also helps one particular person. But those were really deeply concerning text messages, but the staff person who got them was not going to come forward. And that's something we see regularly with students. But then when we start seeing patterns where they're afraid, because they're afraid they're not going to get the recommendation they need going on to residency, something like that. And the funny thing that I feel that we're going to see more of, these kids now who are coming to you in med school, they've been in undergrad and they're learning Title IX. And they're learning that when they do complain, they're protected now. And you can't do a bad eval about them.
So I've been hearing in the last couple of months, secondhand stories of violations like that.
I think you
How
still
do I
report
do-
it.
What do I do then? I mean, because I'm hearing it secondhand, can I still report it?
I think if the person you're referring or that you're hearing it from is an employee of the university, you should remind them of their reporting obligations. Meaning if they're saying, this is what I saw, tell them they should be reporting it, but you can report it and you can include names, including the person you heard it from. And it depends on what they're getting, whether Title IX is something enough that they can chase. Or again, they could look to environmental factors, better training factors. We've improved some university training because of some of the gaps that we've discovered along the way.
Well, that's really good to know because,
Yeah.
when, you hear about hearsay and,
Right.
it's not permissible in law sort of thing.
No, but if that will not be what gets someone in trouble, that hearsay. Title IX's evidentiary standards are really thorough. And honestly, I wish more people, especially some of our students, saw what they will do. We have used trigonometry to prove allegations that were made where that became a relevance of whether someone could see or was doing something that had to be a violation of policy. We use security footage. We use the logins, to prove whether someone was there or wasn't there during a time frame, those kinds of things. So we use a lot to build towards an actual case. The other thing I believe that has improved things in our system is it used to be, let's say Peter and Michelle were on opposite sides of a case. They could be both students, faculty, staff, a blend, whatever. And they went through the Title IX process. It was a one officer decision. And very often we saw both parties were deeply unhappy and both parties said it was a grossly unfair process. Many cases now go before a hearing officer. There are opportunities for informal resolution, which seems to make both people a little happier because they both had to agree and sign off on something. But when it goes before that hearing board now, you have a group of people who have made a decision. And it seems to have been something that people say, I may not be like it, but I understand there was a fairness to the process. And so we are seeing better outcomes from our cases now. But there is still a lot done behind the scenes when we sense something, but we don't have enough to take a formal action on. But we look for opportunities like training, and we look for opportunities like better policies, whatever we can to intervene and improve things. Did you have a question?
Yeah, so it's very similar to what Peter just asked.
So one staff complained to me, she heard some words from a third party about herself.
Yeah, so
And-
she's hearing it as hearsay and now it's a second layer for you.
Yeah, so I offered to her, okay, there's, you can report to Title IX office.
Mhm,
And then she said, since I don't know whether the words are true or not,
mhm.
I would not take any action. Then I asked her again, say, well, also I'm obligated to report.
Mhm.
So I will file a report. She said, no, do not.
She doesn't have that choice. You don't, and that's what you can say to someone, look, I don't have a choice. I'm gonna be emailing someone about this, the right office. It's gonna be up to you whether you participate in anything going forward.
So I still need to report, even
Yes.
though this person told me do not.
Yes.
Okay.
Mhm. It is better if you are upfront with them and say, look, I'm doing it. It's gonna be up to you whether you take this any further. I'm just doing what I have to do. So there's another resource, and I think we didn't necessarily have it up there, but it is on Title IX's pages, and that was one of the resources. But we have a VIP center. So the VIP center is a confidential advocacy, and you can go there because you were assaulted. And you don't know what to do next, but you can also go there and say, look, I'm having a real big problem with my workplace or with some environment here at Creighton. And I don't know how to improve it. And they can give you resources and help and ideas for how you can help yourself. So that's another resource that it's not necessarily about going to a complaint, but maybe it would help you if you talk to the VIP center folks. It's confidential and they might give you some ideas. Because they could even say to you, I'm gonna help you interact with that person to protect yourself, right? And so there's a lot of things the VIP center can help you with in growing and dealing with what you perceive might be a difficult workplace situation. Documentation, we've already talked about it a lot today, where I say there's what the manager can do. We do have a newly updated policy on record retention. And attached to that, if you look on our page, that's the link is there. If you look on that page and you find that policy, underneath the policy is a retention schedule. And that's nice because you can go through and look up what records I have and figure out what my retention schedule is. Research records, though, I've highlighted that here. Those are covered by both your federal rules, if that's applicable, and also the contract if it's externally funded. So we have our general retention requirements, and then you may have specific ones related to that particular study. One thing that's been missing in many institutions across this country is everybody in a lab has a lab notebook. What are you doing to make sure that stays here when the individual leaves the organization, or at least a copy? If you don't have a practice and a policy for how you make sure you keep the necessary copies you need, because you gotta be able to prove that the work was done under your grant, whether it's federal or private, you've got to keep those records. So have a policy for your, and work through what your practice and your methods are saying, because I'm gonna want to keep my record with me as I go on, but you're gonna need a copy. Do you make me make copies monthly? Do you do it right before I'm leaving? Dr. Bartz has sat on a research misconduct matter that taught him a lot of useful life lessons, as well as including, I don't want to spend my days with the lawyers. But one of the lessons in that was around the PI carries a heavy burden when they don't keep documentation. You don't want to be that PI. So you don't want to look like you've not met the burden of retaining those records, because that in and of itself is misconduct. So as the PI, both checking that someone's keeping records and having a good procedure for how you will make sure you've got those copies. That's really important. And that's not just the lab notebook, but anything that's on the computer systems as well, and should be on the computer systems and not their personal devices.
Right, and And it's so much more complex in today's world because so much of our daily work in the laboratory exists in various forms.
Yes,
Electronic or written,
yes.
trying to keep it in one place.
Trying to keep it in one place. So you can say, I expect you to store your electronic files on this server, a Creighton server. I want it created and I want it kept there. And if it can't be because it's on some funky device, then you're gonna have to address that as well. And maybe you have to print something out and copy it and put it into that shared device. And then that's also, you're not losing it because a laptop breaks, because laptops break, right? At a greater frequency than servers that are backed up. And you can make someone VPN in when they work remote and use that server and not something else if they're out in a field doing something or at another site. So you can address all those and it's work. And I'm not being prescriptive because it can be unique to the type of work your people are doing, the type of devices they may need to be using. But, and here's another dividing line. If that's an Apple that you own, or if this is something Michelle owned, then the university in a research misconduct matter has the right to take that device from you. So they've taken, I was there taking a device from a grad student once, and it was hers. We gave it back after we mirror imaged the entire device. And she says, but my personal finances are on there. And I said, well, we probably won't be looking at those. But sorry, it's now ours because we have no choice, especially with a federally funded investigation. So keep your personal life separate from your work life, especially as a Creighton employee on a Creighton-owned device. But when it's grad students, you should be letting them know about some of those issues and concerns. Maybe they will use a hard drive that's for Creighton. So that's what's at risk, or somehow they'll hard drive off their personal stuff. But anytime you merge, I will tell you this, I watched a faculty member lose an attorney-client privilege in a personal lawsuit because they wrote to their lawyer using their Creighton address because it was easy for them. And it blew the privilege in that case with respect to those emails. Didn't hurt them, they got lucky. But in some cases, it can blow the privilege entirely. So you don't want to use your Creighton email address for personal business. As a general rule, if you're just writing to your spouse and saying, hey, I'm going to be late, maybe you don't care. But I'm saying keep your walls clean because it is much better for you. You don't really want to have us take a device and see stuff you don't want. And that is certainly true of your university-owned laptops. But if you're doing research that could fall under these policies, it could go to a private device as well. It could go to your phone. And for people who don't understand this, you guys are all probably much more tech savvy than some of my offices. But every keystroke is on here. You've seen probably some crime shows that kind of demonstrate that, but it's really all on here. So you got to destroy this before you've really gotten rid of anything. So,
This is.
I'm sorry, but I watched an employee sweat bullets when they were asked in an investigation by a party external to Creighton for their phone, and they tried to fight it, and the entire phone was mirror imaged. I still to this day don't know what made the sweat bead off their face, but it did.
That's the problem, in particular with students who are not provided with any.
That's right. The best thing you can do is say, everything you do, you need to store it on our server.
Something to come out of prior research misconduct.
Yes,
I think
that you
was the
also-
recommendation that there's a university supported mechanism for lab notebook documentation that
Did
everybody.
not get implemented, no.
It's a
and-
problem.
More gray hairs.
More gray hairs. I recognize that that was not implemented. I tried to bring that to the attention of new leaders when new leaders came on board. If your school would come up with something applicable to the basic science departments, that would be,
Yeah, so the workaround that we use, so if you're not familiar with 3-2-1 backup, Google it and learn about this. But one of the things that we do, and IT has been actually supportive of this, is there's programs, things called Backblaze. But it's basically, it's like Time Machine, that's cloud-based, and it's platform independent. And so it's a yearly subscription that I used to pay for out of pocket, but now I can get the university to pay for it. And so the student has their own personal computer. We set them up with Backblaze. That backs up the part of their computer that
That
has
you
all
want.
their lab stuff on it. And it's automatic, pushes it up to account in the cloud.
Is it secure?
It's totally secure. And we don't do any human stuff or anything like that, so I don't know. if
So
that's
you don't
where-
know if it meets HIPAA, but short of
But I
that.
don't have to worry about that, but it's relatively inexpensive and it's easy, so the students don't have to think about it, and then we do that for all of our microscope servers. I mean, just anything that generates tons of data, it has its own cloud backup plus hard drive backup.
Could you send me that so we can build that link into the presentation?
Yeah.
That'd be great.
You do that rather than like just saving stuff to a blue server either.
And this is a fixation event in my lab, because when I did this, the blue servers weren't that reliable, and it was when dentistry lost all of everything. I was like, I'm not trusting
It was
myself.
pharmacy.
Was it pharmacy?
It was pharmacy.
Pharmacy, yeah. So we set up our own kind of internal server and just do everything in-house that way, but that's just me being OCD, so.
That'll be
Share
proud.
that with us. I mean,
Yeah.
I think that's something I definitely need to
Yeah.
do.
Yeah.
I think we've got probably 5 more minutes.
So, I don't think there's another slide that we need right now.
No, I mean, I
Yeah.
think that for presentation purposes, I think this is.
Yeah. So, does anyone have a hot question now?
I don't wanna get too like into hypothetical this or that, but a couple of things I've heard, like the issue with overtime, I didn't ever hear that the employee has a responsibility to document that up front. I mean, they can
They
just sort
will.
of come later. I mean, if it's on the time
If,
card,
if you've
then we
communicated,
can have a conversation in real time, like, hey,
absolutely.
I see you log some extra hours, you're gonna get paid for it, but this is my policy. It gives that opportunity for. And I didn't hear that from you guys. I
So
just
what I-
heard what the manager is responsible for
Yeah.
in the after effect.
Right now, I'm saying go back to your lab and you tell everybody, and you write a note to yourself or you send them an email that says overtime is not allowed. It must be pre-approved, and as a general rule, do not expect to get any, right? You could do that. Then when somebody does put it on their timesheet, you can go and you can give them a reprimand of sorts, and you can work with your HR generalist of whether that's appropriate. Maybe it was because of a lab emergency and you'll be like, I'm gonna allow it this time because of some lab emergency. Or you're gonna explain why you can't allow it because it wasn't approved. And while the university may pay for that work once, you're gonna write them up. And then if it was just a in your face defiance, you can write them up on a reprimand. And then you start that PIP process, and they could end up being terminated if they do it again or keep doing it. And so that's how you can be deliberate in your approach on that. But until you establish that baseline, that's why you have a problem. And if they hold it to the end, and maybe you've reminded people on a 6-month basis, and let's say they wait a year and they suddenly try to spring something on you, then we have a defense for you were told, you were reminded, we don't owe you this overtime, possibly.
I guess the other thing I heard too was someone brings a Title IX claim, then there can be no like
It's
annual
harder.
review kind of like,
Mhm. You then.
like you lose your
here's-
ability to objectively.
No, you can objectively, but you're gonna have to be careful. But a negative review where I'm trashing you to your, in a GME application, for a residency, you're gonna have a harder time. But if you, then as a manager, what we would be pushing back on is this retaliation, or do you have clear objective measurements for the problem in their performance? You're gonna have to have something real objective to hang your hat on, or it can be retaliation.
And it's
And
easy enough if they-
retaliation lasts a little while.
If they ask for a letter of rec, you can just inform them that it probably won't
Come from,
read how they would prefer it to read, and maybe they should ask someone else.
yes. I'm not, yeah, because you don't owe them that obligation of a letter of recommendation.